Have you ever wondered what's in our air? Did you know that there are millions of minute particles that we can't see nor we can't feel?
Let's imagine going to a room full of bubbles, freely floating in the air. Then suddenly, each one of them bursts simultaneously and disappear.
What if I tell you that one bubble created more minute air particles that your naked eye can't see? These minute particles can be suspended in the air for hours and hours, and we don't even notice it.
Since the early centuries, we have learned a lot about hygiene and vaccines, but there's still one aspect of infectious disease that we still don't understand, and that is the mechanism of airborne disease transmission.
Airborne particles are easily transmitted in the air by sneezing, coughing, or talking. These particles, once released in the air, can be suspended for a long time and unknowingly becomes infectious when contaminated with somebody that is sick. Now our question is, how do we protect ourselves? How do we protect our patient? How can we prevent these infectious airborne pathogens from entering the body? Good evening, everybody. My name is Maria Perez.
And my name is Cindy Cepeda, and we're here to talk about the different types of surgical masks and N95 respirators and how effective they are to filter airborne particles in a dental setting. So, do your task, wear your mask.
Since the early 1900s, face masks or surgical masks have been used to prevent infection of surgical wounds from healthcare workers that generate oral and nasal bacteria. In 1897, surgical masks were introduced as one layer of gauze and progressed to two layers of gauze, which are more effective. By the 1960s, disposable face masks made of paper and fleece were introduced to the world.
Dental healthcare workers are at the forefront of encountering health hazards and have the highest risk of cross-contamination due to the infectious airborne particles between the clinician and the patient. In order to protect healthcare workers and the patient, the use of personal protective equipment is recommended. In our survey, almost 95% of dental healthcare workers follow the protocols on doffing and donning PPE, and 90% wash their hands or use hand sanitizer before using surgical masks. These procedures are important to prevent cross-contamination between a dental healthcare worker and the patient.
So who does the testing for all the surgical masks that we are wearing? Well, the American and Society of Testing Materials is the agency that was responsible for determining the mask specification requirements for healthcare workers. The surgical masks are levels 1, 2, and 3 and are based on resistant categories including fluid resistance, bacterial filtration, particulate filtration, and differential pressure. Level 3 mask, which can be seen in a dental setting, ensures that the mouth and nose are protected against fluid microorganisms and particulates. But there is one problem. The surgical mask does not provide effective hermetic seal for highly infectious aerosols.
The National Institute for Occupational Safety and the U.S. Food and Drug Administration approved a filtering facepiece respirator that can filter highly infectious airborne particles. These respirators are rated as N, R, and P, which are based on their level of protection against oil aerosols. This is important because some industrial oils can remove electrostatic charges from the filter media of a respirator, which can degrade the filtering performance efficiency of a respirator. The propylene network combined with electrostatic charges found in a respirator can filter aerosols going inside and outside this mask, which protects both dental healthcare workers and the patient.
Did you know that the N95 respirator, which are widely used in the US, are manufactured in the void or the dead space? Dead space is created to protect dental healthcare workers against the buildup of carbon dioxide when used for a long period of time. In recent studies, the humidity, moisture, and temperature created inside the N95 mask can bring thermal discomfort and can exacerbate the degradation effect of moisture on the electrostatic surface of the mask. 50% of dental professionals agreed that the comfort level of surgical masks are higher compared to an N95 respirator. The N95 respirator gets uncomfortable when worn for a long period of time. This can greatly impact the effectiveness to filtrate infectious particles because the wearer has a tendency to wear it inappropriately, exposing critical areas like the nose. It can also result in the loss of hermetic seal, which is critical when working with highly infectious particles.
While the use of surgical masks is very effective in prevention of diseases, the N95 respirator is still the most effective respirator in preventing airborne transmission of infectious diseases. Dental professionals should take the best precautions possible and using surgical masks and N95 respirators. They should know the difference between the filtration efficiency of this mask and the respirators so it can be used appropriately. The efficiency of surgical mask and N95 respirator is not only based on the particulate and bacterial filtration capacity, but also how the dental healthcare workers follow the proper infection control protocol. Fit testing of an N95 respirator is highly recommended to prevent the transmission of airborne particles.
For the protection of dental healthcare workers and patients in regard to infectious airborne particles, it is recommended to always follow the Center for the Disease Control and World Health Organization guidelines for appropriate use of surgical masks and N95 respirator. It is the responsibility of dental healthcare workers to be up to date and aware of the recent guidelines to protect themselves and their patients from infectious airborne particles. So to all the dental healthcare workers, do your task and wear your mask. Thank you for your time.